The cannabis industry was immediately on the fast track when Massachusetts legalized recreational marijuana. But critics argue the drug's safety didn't get enough attention.
There has been contamination in some products, and some customers say they're not getting what they paid for. WBZ's Louisa Moller has been investigating the problems and gets answers from the head of the state's Cannabis Control Commission.
Money has flowed into Massachusetts state coffers ever since the legal cannabis industry kicked off in 2018.
It's more money than comes in from the alcohol industry.
Sales have grown every single year, garnering more than $1.5 billion annually, nearly $40 million just during Thanksgiving week, and more than $250 million in tax revenue for the state every single year.
What they're doing is they're ripping off the consumer.
But Matt Gutwill, president of the New England Narcotic Enforcement Officers Association, argues cannabis consumers aren't getting what they're paying for.
I'm using a NIR Labs device.
He used this tool to measure THC, the psychoactive compound that makes users high, in over 100 marijuana samples from multiple dispensaries over the past 2 years.
I take my system and I just lay the device up on top.
In a significant number of cases, Gutwill says the THC level in the test comes back lower than what's advertised on the product's label.
It's saying it's 12.8% and 0.1% CBD. But when we purchased this, it said that it was a 34.65% THC level.
He showed us over and over.
This is coming back at 16.8%. So if it was what they said, which was 28, we're way off anyway, but on the side of the pack, it's saying 34.19.
And contends it's a symptom of a bigger problem, a lack of oversight by the Cannabis Control Commission, or CCC, the regulators which oversee the industry.
They are doing nothing on the enforcement end.
Over the summer, the CCC suspended the license of Assured Laboratories, one of over a dozen labs responsible for testing cannabis products before they are sold at dispensaries. The CCC found that Assured failed to report evidence of yeast and mold in more than 7,000 of its lab samples, with more than 500 above the legal threshold for yeast and mold. Dr. Zoe Weiss, the director of clinical microbiology at Tufts Medical Center, says mold can have a severe impact on the immunocompromised.
It can enter the lungs and it can cause pneumonias that can lead to even areas of like a ball of fungus in the lungs that can invade the blood vessels in the lungs.
The lab sued the CCC, arguing they didn't get due process, and reopened a month and a half later after paying a $300,000 fine.
The one thing the commission did not do was pull those products from shelves. Why was that?
Is there more to do? Yes, there is. But those products, once identified, they were frozen in place, and consumers and patients couldn't purchase them.
We sat down with CCC Chair Shannon O'Brien and Head of Public Safety Kimberly Roy.
We are working to have a product recall policy in place.
Got it. So they weren't further distributed.
That's right.
But they weren't physically recalled.
Exactly.
The two did not refute that THC levels could be manipulated.
What you're referring to is more consumer and patient fraud. So you pay more for higher potency THC, so folks, patients, consumers are paying additional.
They say they're advocating for a secret shopper program, which would allow the CCC to conduct regular randomized buys at retailers and test their products.
The secret shopper program is something that we raised in this very room over 3 years ago, and we were actually told by senior staff that we had a secret shopper program, which we don't.
To date, the CCC has only used secret shopper to follow up on tips. All of this within a regulatory framework being built along with the industry.
Sometimes you hear the industry being compared to big tobacco, that the profits are so good that maybe regulators are looking the other way. What would you say to critics like that?
Oh, I would disagree with that. We are regulators protecting public health and safety, but this is also an economic driver in this state.
We reached out to Assured for comment and didn't hear back. Louisa Moller, WBZ News.